My name is Dr. William Carter, and I'm a vascular health and aging specialist based in the UK. I've spent over 30 years working with seniors, men and women in their 60s, 70s, even late 80s, helping them walk stronger, feel lighter on their feet, and regain a sense of independence they thought was lost forever. Over the decades, one troubling complaint has echoed through my clinic time and again. They say, "Doctor, I don't have pain, but my legs feel like they're filled with lead. Just heavy, slow, tired." It's often brushed off, even by other professionals, as just aging. But let me be clear. When your legs feel heavy, your body is trying to tell you something. It may not be loud, but it's persistent. It's not normal aging. And if you understand the warning signs, you can take action before it turns into something more serious. That's why I made this video. I've seen too many people ignore this feeling until it affects their mobility, their balance, even their heart. But I've also seen people turn things around with just a few small, smart changes. So in the next few minutes, I'm going to walk you through what's actually going on inside your legs, why it's happening, and what you can do about it. I'll also share 2 medical studies that every senior should know, along with stories of people like Martha and James, real patients who came to me with heavy legs and left with lighter steps and renewed energy. This isn't just a medical issue. It's a quality of life issue. And I want you to know that you have far more control than you've been told. Let's begin with the most common and most ignored cause of heavy legs after 60, poor circulation. As we age, the veins in our legs naturally weaken. These veins are responsible for pushing blood back up toward the heart, working against gravity. When they lose strength, blood begins to pool in the lower legs, leading to a condition known as chronic venous insufficiency. You may not see swelling right away, but your legs start to feel tight, heavy, sometimes warm or achy by the evening. This kind of fatigue doesn't come from walking too much. It comes from not walking enough, from sitting too long, from muscles that no longer contract enough to assist blood flow upward. I'll never forget Martha, a 74-year-old retired schoolteacher who had always been active. But after the pandemic, she spent more time indoors, sitting longer hours, moving less. By the time she came to see me, she described her legs as 2 wet bags of sand. Not painful, not swollen, just slow and heavy. She had started avoiding stairs. Even her short evening walks felt like a burden. After a simple Doppler test, we found her venous return was sluggish. Nothing dangerous yet, but enough to explain that uncomfortable heaviness. We didn't put her on medication. We didn't send her to the gym. Instead, I gave her a walking plan. 10 minutes after breakfast and dinner, plus seated calf raises and ankle pumps throughout the day. Within 3 weeks, she felt lighter. Within 2 months, she said, "Doctor, I finally feel like my legs belong to me again." Sometimes, healing starts with awareness. Other times, it starts with movement. But circulation isn't the only culprit. Another common cause of heavy legs in older adults is peripheral artery disease, or PAD. Unlike vein problems, this involves the arteries, the vessels that bring oxygen and nutrients into the legs. When these arteries narrow due to plaque buildup, oxygen supply to the leg muscles drops. That's why some seniors notice leg fatigue just a few minutes into walking, because their muscles are starving for oxygen. In early stages, it's not painful. It just feels like your legs are too tired for how little you've done. And most people don't connect that to their heart. But PAD is often a sign of widespread cardiovascular issues. This brings me to James, a 67-year-old former mechanic who always prided himself on staying active. But slowly, he began feeling that his legs just wouldn't cooperate anymore. He still walked daily, but he needed more breaks. At first, he thought it was aging. But when he came in for a checkup, his ankle brachial index test, a measure of blood flow to the legs, showed signs of mild arterial narrowing. We caught it early, which was crucial. With diet changes, light walking, and a few circulation-boosting habits, we not only improved the heaviness in his legs, we likely prevented a heart event down the road. That's how connected the body is. I want to pause here and ask you, have you ever experienced heavy legs, especially in the evening or after sitting for a long time? Let me know in the comments below. Sometimes we think we're alone in these struggles, but once you speak up, You'll see how common it truly is. And your comment might encourage someone else to take action too. Now, I want to share two powerful studies that shed light on this issue. The first comes from the American Heart Association, which published a study on older adults with leg fatigue. They found that nearly 40% of seniors reporting heavy legs had undiagnosed circulation issues, including early-stage PAD and chronic venous insufficiency. What's more surprising is that many of them had normal blood pressure and cholesterol, meaning the leg symptoms were their first clue. That's why I always say, listen to your legs. They often speak before your heart does. The second study comes from the Journal of Geriatric Physical Therapy. In this trial, seniors aged 65 to 80 who added just 15 minutes of daily calf activation exercises, like toe raises and ankle circles, reported a 35% improvement in leg fatigue after 8 weeks. And none of these people were on new medications. That's the beauty of targeted movement. It wakes up the circulation system without stressing the joints. So, what can you do if your legs feel heavy? First, move, even a little. 10-minute walks twice a day can stimulate both your veins and arteries. Second, elevate your legs for 15 minutes in the evening. This helps drain pooled blood and reduce pressure. Third, consider mild compression socks if you've been sitting for long hours. And fourth, stay hydrated. Dehydration thickens your blood and slows circulation. These aren't magic cures, but together, they give your body the signals it needs to improve blood flow and restore lightness. I'd like to share one more patient story. Eleanor, age 79, came to me saying she felt like her legs had turned into stone. She'd stopped dancing, stopped walking her dog, even avoided shopping trips. When I asked about her daily habits, it was clear. She wasn't moving much, and she was barely drinking water. Her blood work showed mild inflammation, but no major disease. What she needed was confidence and structure. We created a routine, morning stretches, a 15-minute music walk, and a hydration goal of 6 cups per day. Her transformation wasn't overnight, but by week 5, she was laughing again. She said, "Doctor, I can feel the ground under my feet again." That's what this is about, not just fixing the body, but restoring a sense of control. So if you or someone you love is over 60, and struggling with leg heaviness, don't dismiss it. It could be circulation. It could be early nerve dysfunction. It could even be the first whisper of heart trouble. But more importantly, it's often reversible. Your legs are speaking to you. They're not weak. They're just waiting for a new signal. Give them gentle motion. Give them better blood flow. And give them your attention. Your body still listens, even now.